Alzheimer's. It is an irreversible neurological disease that causes memory loss and dementia, mostly as a result of the death of brain cells with old age. Alzheimer's, which usually has an insidious onset and progresses slowly, increases with age. Many people have the perception that Alzheimer's is a disease of the elderly. This is not true, because although Alzheimer's is a type of dementia that is mostly encountered in old age, 5% of people with this disease are around 40 to 50 years old. It is thought that there is a genetic predisposition to this disease in families of people who have Alzheimer's under the age of 60. Alzheimer's is a disease that affects not only the patient himself, but also his relatives psychologically and socially. For this reason, you need to give importance to your mental and physical health in order to communicate better with your patient diagnosed with Alzheimer's, to deal with the feeling of helplessness, and to cope with the feeling of helplessness. First of all, the patient's relative should take good care of himself, share his feelings, and cooperate with his doctor constantly. What is Alzheimer? The striking finding of Alzheimer's immediate memory loss occurs with symptoms such as the inability of the person to remember name, address information, date, current media names, and personal information, especially home address and telephone number, decreased ability to think logically. It occurs with symptoms such as difficulty in performing complex tasks and personality changes. The fact that memory loss, personality changes, and possible psychological problems become dangerous and require medical treatment reduces the quality of life of the person. This disease, which negatively affects abilities such as memory, thinking, and learning, makes it difficult for the patient to perform even simple daily activities in the later stages. Alzheimer's is the most common type of dementia, and because it is a progressive disease, its symptoms often increase with age. Alzheimer's disease, in which the first symptoms are seen mostly in the 60s, manifests itself with memory problems at the beginning. Memory disorders in Alzheimer's belong to the recent past. At first, patients begin to forget dates and names of people, and they experience difficulties in wandering around familiar places. Personality changes and other psychological problems can be added to these problems. The risk factors for Alzheimer's are as follows. Advanced age is the largest known risk factor for Alzheimer's disease. Alzheimer's is not part of normal aging. However, as you get older, the likelihood of developing Alzheimer's disease increases. People who have a first-degree relative of a parent or sibling who have the disease at a young age are slightly more likely to develop Alzheimer's than others. Many of the genetic mechanisms of Alzheimer's are largely unexplained among families, and genetic factors are complex. Patients with Down syndrome have a very high risk of developing Alzheimer's disease. This is related to having more than normal 3 copies of the protein that causes beta amyloid formation on chromosome 21. Alzheimer's symptoms tend to appear 10 to 20 years earlier in people with Down syndrome than in the general population. People with mild cognitive impairment (MCI) have a significant risk of developing dementia. When the primary MCI deficiency is memory, the condition is more likely to progress to Alzheimer's disease-related dementia. Studies show that it is associated with an increased risk of Alzheimer's disease in people who do not have sleep patterns, untreated depression, head trauma, smoking, or exposure to secondhand smoke. Researches showed that the same risk factors associated with heart disease, such as lack of exercise, obesity, high blood pressure, high cholesterol, diabetes, can also increase the risk of Alzheimer's disease. In cases where insomnia and depression come together, the risk of Alzheimer's increases. As a matter of fact, studies have shown that the rates of Alzheimer's disease are very high in societies where insomnia and depression are common. Since protein deposits in the brain of a person who sleeps 8 hours a day can be cleaned better, it is possible to delay the symptoms of Alzheimer's. On the other hand, the incidence of Alzheimer's varies between genders. Although it is stated that Alzheimer's is more common in women than in men, It should be taken into account that one of the factors leading to this condition is the longer average life expectancy in women than men. What are Alzheimer's symptoms? Loss of memory, decreased reasoning ability, putting objects in strange places like putting glasses in the refrigerator. Closing parenthesis. Impairments in functions such as clouding of consciousness, ordering things, personality changes such as nervousness, stress, aggression, and depression. Confusion in the concepts of event, time, and person. Repeated questions. Having trouble doing familiar tasks, taking longer to perform. Constantly getting lost. Not being able to recognize the environment in familiar places. Having trouble sleeping. Trouble speaking, acting unaided, and doing self-care tasks. Experiencing hallucinations and delusions. Behavioral symptoms. Can Alzheimer's disease be prevented? Alzheimer's is not a completely preventable disease. However, with a series of lifestyle changes, the risk factors for Alzheimer's can be reduced to some extent. Scientific researches. It shows that steps to reduce the risk of cardiovascular disease, such as eating healthy and exercising, can also reduce the risk of developing Alzheimer's disease and other disorders that cause dementia. Healthy lifestyle choices that can reduce Alzheimer's risk include regular physical exercise and walking, doing regular mental exercises, eating fresh produce and following a diet of healthy fats and foods low in saturated fat, following treatment guidelines to manage high blood pressure, diabetes, and high cholesterol. Quit smoking. It is absolutely necessary to seek expert help in order to understand whether the forgetfulness complaints indicate Alzheimer's. For example, with a simple blood test, the vitamin B12 value in the blood can be checked, and if deficiency is observed, the patient's forgetfulness complaints can be stopped with vitamin supplements. On the other hand, with another blood test to be performed on the patient, the thyroid hormones and thyroid-stimulating hormone values in the blood should be checked. Don't forget to like the channel and subscribe.